Hello everyone, my name is Rohan Thapa and today I will be presenting on interpersonal skills in mental health nursing. Effective interpersonal communication is an essential part of mental health nursing because nurses need to develop trust, understand consumer experiences, and communicate in a way that supports their dignity and involvement in care. In this presentation, I will discuss important interpersonal skills, therapeutic communication, the recovery oriented practice, trauma informed care, and I will also explain how these concepts can apply during a simulated mental health nursing care. So, the first slide is it's about interpersonal skills. Interpersonal skills are abilities we use to communicate and develop relationship with other people. In mental health nursing, interpersonal skills involve much more than simply talking to a consumer. They include listening carefully, showing empathy, recognizing or nonverbal communication, responding without judgment, respecting the person's individual experiences. These skills are particularly important to because consumers experiencing mental health challenges may feel anxious, depressed, vulnerable, and frightened. The way a nurse communicates can therefore influence whether a consumer feels comfortable and safe around them. Effective interpersonal communication helps create an environment that where consumer feels heard, respected, and involved. Slide 3. Slide 3 is about core skills used by mental health nurses. It includes active listening. First of all, for active listening, this means giving the consumer full attention rather than just simply waiting for to reply. Second is empathy. Empathy, which involves recognizing and trying to understand the consumer's feeling and and experiencing without judging them. Open-ended questions are also important because they encourage consumers to explain their experiences in their own words rather than giving only yes or no answers. Non-verbal communication is also another important factor. Appropriate eye contact and open posture, facial expressions, and tone of voice can demonstrate interest and respect. Mental health nurses can also use reflection and validation to include to acknowledge that what the consumer is experiencing. Finally, the nurses and must maintain appropriate professional boundaries while treating consumers with dignity and respect. So the another slide is about therapeutic communication in practice. So therapeutic communication is purposeful communication that supports the consumer's well-being and develops professional therapeutic relationship. One way of understanding this process is through 5 steps: open, listen, reflect, and summarize. First, the nurse opens the conversation using a respectful introduction and open ended questions. Second, the nurse listens carefully to both verbal and non verbal ways of communication. Third, reflection can be used to demonstrate understanding. For example, if a consumer describes feeling overwhelmed, the nurse can acknowledge that experience rather than immediately trying to solve the problem. Clarification is then used when the information is unclear or when nurse needs a better understanding of what the consumer needs. Finally, summarizing this point allows the nurse to confirm the main issue discussed and make sure that both the nurse and consumer have a shared understanding. So the next slide is about applying those skills in my interview. These communication techniques can be demonstrated during a simulated mental health interview. For example, imagine a consumer reports increasing stress, low mood, and difficult coping. I would begin by introducing myself and creating a calm and respectful environment instead of immediately asking for a number of closed questions. I could begin with an open question, such as asking the consumer to tell me about what has been happening recently about their mental health. While the consumer speaks, I would use active listening, make appropriate eye contact, and attentive body language. I would also take pauses instead of interrupting them and use reflection and validation to acknowledge their feelings. I could then also clarify important information and summarize what they have told me. Throughout the interaction, I would involve the consumer in the conversation, maintain professional boundaries, and then finish the interview respectfully. This demonstrates how interpersonal skills can be practically applied rather than simply discussed theoretically. So, another slide is about why communication matters in mental health nursing. Effective communication is also important in mental health nursing for several reasons. First, it develops trust. Consumers are more likely to discuss sensitive experience when they have trust on the nurse and that they feel that no and they feel that the nurse is genuinely listening them rather than judging them. Secondly, communication supports accurate assessment, information about mood, thoughts, behavior, coping strategies, and potential risk often comes directly from conversations with consumers. Communication also protects dignity by recognizing the consumer as a person rather than defining them by a diagnosis. Another important benefit is partnership. Mental health care should also involve consumer in decisions instead of making every decision for them. Slide 7. Therapeutic relationship. The therapeutic relationship is a professional relationship between the nurse and the consumer that focuses on consumer's well-being and health. Trust, respect, empathy, professional boundaries are essential elements of this relationship. Unlike friendship, the therapeutic relationship has a clear professional purpose and remains focused on consumers' need, which also focuses on person-centered care. Mental health nurses need to be supportive while also maintaining appropriate boundaries, professional boundaries. Other would be consistency is particularly important when nurses communicate honestly, keep appropriate commitments, and explain what's happening. Consumers may develop greater interest in them. A strong relationship can encourage consumers to participate more actively in assessment, treating, and recovery. For this specific reason, interpersonal skills provide the foundation for developing an therapeutic and effective therapeutic relationship. Slide number 8. It's about recovery-oriented mental health practice. Recovery is not simply the absence of symptoms. It is a personal process in which people are supported to live meaningful lives, exercise choice, and build on their strength. Recovery does not necessarily mean recovery-oriented place practice focus on helping people live meaningful and satisfying lives while recognizing their individual goals and strengths and choices. Communication plays an important role in supporting recovery rather than assuming what is best for the consumer. The nurse should ask about the consumer's own priorities and goals. For example, instead of focusing on only on symptoms, a nurse might ask what the consumer would most like to improve in their daily lifestyle. This approach recognizes the consumer as an active participant in their care. By listening to consumers' preference and supporting shared decision making, nurses can promote autonomy, empowerment, and recovery of the patient. Slide number 9 is about trauma informed care, communicating for safety. Trauma informed care recognizes that people assessing mental health services may have experienced trauma and that healthcare interactions should avoid causing further distress or re traumatization. Important principles include safety, trust, choice, collaboration, and empowerment. Communication strongly influences whether these principles principles were achieved. For example, nurses should explain what they are doing before beginning assessments or procedures and avoid unnecessarily controlling communication. Providing choices where possible and can help consumers maintain a sense of control and also give and also empowers the consumers right. The nurse should be also respectful use should also use respectful language when communicating with the consumer. And a trauma-informed approach does not require the nurse to know every detail about the person's trauma. Instead, it means communicating and providing care in a way that promotes psychological and physical safety to the consumer. 10th slide, how the concepts work together. Interpersonal skills, therapeutic relationship, recovery-oriented practice, and trauma-informed care should not be viewed as a completely separate concepts. They work together during everyday mental health nursing interactions. For example, active listening, empathy has established help establish trust with the patient, with the consumer. Trust supports the therapeutic relationship. When nurses provide consumers with choices and involve them in decisions, they support both recovery-oriented, and trauma-informed practice. Similarly, respecting boundaries and communicating clearly can increase safety and reduce the possibilities of distress. This means that one conversation can involve several principles at the same time. The nurse communication style can influence whether the consumer feels ignored, powerless, or respected, safe, and involved in their own care. So, last slide is about the conclusion. Conclusion, it says communication is a part of the intervention. So at the end, concluding, interpersonal skills are fundamental to effective mental health nursing practice. Active listening, empathy, open-ended questioning, non-verbal communication, reflection, validation, and professional boundaries allow nurses to communicate therapeutically with the consumers. These skills contribute to trust, accurate assessment, dignity, safety, and partnership. They also support the main message from this presentation is that communication is a part of the intervention itself. The way a mental health nurse listens, responds, and communicates can directly influence the consumer's experience of care and their willingness to participate in the recovery.